Done this for 2.5 weeks now, Dr. Sapphire. Why isn't our curve bending? The people that were infected were infected. At the very least, wouldn't you think in theory the numbers should be going down?
So no, Brian, I don't think the numbers should be going down quite yet, and here's why. This is because that this virus itself has a long incubation period, and it's a prolonged phase. And you say that we should be seeing numbers going down, but we are seeing the numbers changing because of these mitigation efforts. They're elongating. You hear Governor Cuomo talk about it all the time, Dr. Birx talk about that the doubling time is elongating. It started out at 2 a while ago, now it's over at 6, 7, meaning that there are fewer people going into the hospital. But we're not going to see that decline for a few weeks because the people who are in the hospital right now were infected with this virus some 7 to 21 to 28 days ago. Those are weeks ago. So we're seeing the elongation because of the efforts we've done in the last several weeks. So what we're doing right now, we're not going to see the results of that for another 1 to 3 weeks. So you got to give it some time. But I tell you, in the next 1 to 3 weeks, we are going to start seeing that down as long as we continue on the path that we're on. And when I'm saying that, I mean that for New York City. Other places in the United States right now, such as California, they're doubling times getting faster. So we really need to keep a close eye on other places across the country.
Well, when it comes to deaths, Wednesday, we saw 1,047 here, and on Thursday, 911. So that's gone down a little bit. What about this antibody test? Can you tell us more about it? Is that the same thing? It's approved by the FDA. It's going to determine if you've had it or not. It's a blood test. Is that the same as the serology test that I'm reading about too?
So a lot of people are getting confused because the verbiage it kind of overlaps a little bit. So the serology test, serology meaning blood essentially, is the blood test. And what that is, they're looking for an antibody in your body. That antibody says whether or not you've already been exposed to this virus and your body's immune system's already kicked in. And the leading theory right now is once you've had this infection, that confers immunity, meaning you probably can't get it again. And if you do, you probably have a much less severe case with the illness. That's very different from that nasal swab, which we've been doing, which is actually looking for virus particles in itself. And the serology test, the blood test, looking for the antibodies, has been approved, and they're going to start getting it out there. And the good thing about this is we can start doing it on our healthcare workers and the people who, potentially can go back to work. We need to know who has immunity before we can start opening up businesses, but we have to open up businesses. But Ainsley, you touched on the fatality rate, or the people that are dying. One thing that is very important right now is the fact that the people who go on ventilators, studies all across the globe, including the United States, are showing less than 50% of the people who go on these ventilators are actually being discharged alive. A lot of people on the ventilators are dying, and that is something that we have to tackle, and that's why looking at these treatments, from the serum antibodies to the hydroxychloroquine and the zithromycin combination, the antivirals like remdesivir, these are crucial because we need to avoid putting people on the ventilators, not only because we have a shorter supply of ventilators, but because people are not surviving, and so we have to focus on these treatments.
Yeah. Well, Dr. Sapphire, you've done such a good job explaining generally how everything is working, but people are watching, they've got specific questions about their situations. We got an email from Cindy. She says, I work in grocery retail and I have a family member who is at risk. What precautions should I take not to get the virus and bring it home? Because that is the big worry, isn't it? Bringing it to somebody that never would suspect that you're the carrier.
Well, Cindy, you are on the front line, in my opinion. You are there. You're continuing to help people get their food, and you have a lot of interaction with people. So I implore you to consider wearing a mask. But the important thing is to really make sure that there's a tight seal around your mask, because if it's just a loosely fitted mask or your nose is hanging out there, it's not doing you any good. But because you're in such close contact with so many people, I think it's in your best interest to wear a mask. Make sure you're washing your hands a lot, maybe even every 20 minutes. And when you get home, change your clothes immediately, get in the shower, and really wash off everything that you've come in contact with that day before you bring it into your home.
All right, let's go to another question, and this is from Laura. How often should masks be changed? I guess the regular mask and the N95.
well, unfortunately, that's changing a little bit right now because of the short supply of them. Typically, we should only wear a mask for one instance at a time. For a physician, when we see a patient, we wear a mask, then we throw it away. Right now, what we're doing is we're trying to keep one mask throughout the entire day. These are just surgical masks. N95 masks can last longer until they're visibly soiled on the outside. But right now, you try and use at least one mask a day. We like to put it out in the sunlight. The UV rays can actually help sanitize it. If you want, you can spray it down with a disinfectant, but you really want to make sure that it's dry, and you even wait maybe 24 hours before you put it on your face, because I do not want you inhaling those chemicals, because that in itself can cause lung injury.
Okay, this is an email from Cheryl. She says, I want to plan for life after the virus. When can I host a baby shower? Is mid-May too soon?
Oh, don't we all want to plan for life after this? I like thinking in the future. I like thinking of things that we're going to do. Mid-May may be just a little too soon, especially if we're talking about a pregnant woman who's somewhat high risk. So I would just hold off on that. For me, I'm planning things for after the summer. Do I think that we're going to get out and be able to do a lot of things during this summer? Absolutely. But really, if you're planning anything, solidified that you want to invite people to, I would wait until after the summer months.